Hi, I'm Dr. Jason Cardinale with Dr. C TV. Today, we're going to talk about what top healthcare organizations recommend as the best non-invasive ways to deal with low back pain. According to The Lancet, which for those of you who are not familiar with The Lancet, is a really old medical journal that has been around since the early 1800s. They're one of the oldest, if not the oldest medical journal out there, and they are very well respected. So The Lancet reports that low back pain is the #1 source of disability in the world. Not just our country, but the world. If you've ever dealt with low back pain in the past, you understand how much it can alter your daily life. Even simply standing up straight can feel like an incredibly impossible task, let alone playing with your children, your grandchildren, or even getting ready for work. For that reason, many top healthcare organizations have begun to publish recommendations for the best ways to deal with low back pain. Now, this may come to a surprise to some of you, especially if you've never seen a chiropractor before, but the care provided by chiropractors ranks at the top of many leading healthcare recommendations for relieving low back pain. Movement-based strategies like spinal manipulations, controlled exercise, and dynamic stretching are a few of the most effective ways to relieve low back issues. Not only are movement-based strategies good for providing fast relief, but emerging research shows that they may even be able to offer a preventative effect when continued over time. And this just simply makes sense because consistent efforts give you consistent results. And it doesn't matter whether you're looking to relieve low back pain or trying to get fit in a gym or trying to lose weight with a diet, it holds true in each case. The days of taking drugs and medications for back pain are over. Prescriptions are now rarely recommended as a first option because of their dangerous side effects, addictive nature, and frankly, lack of long-term results. The American College of Physicians published recommendations for the treatment of low back pain. In these guidelines, they separate low back pain into 3 different categories or phases of care, and they give their recommendations for each phase depending on which category your pain may fall into. The 3 phases are acute, subacute, and chronic. Now, if you're not familiar with these terms, that's okay. Basically, acute means it's a new injury. So you walked outside today, you picked up something really heavy, and you hurt your back. In contrast, subacute means that some time has passed. Maybe it's been a week or 2 since you lifted this heavy object, a boulder, outside, and maybe your pain has gone down a little bit. You've seen some improvement, although the pain is still there. That's the subacute phase. And chronic refers to long-term pain. This is something like arthritis or maybe an old injury that has never healed. Regardless which category the low back pain fell into, the American College of Physicians recommended spinal manipulation for all 3 categories. As a practitioner, I am ecstatic that a major trusted healthcare organization has evolved to support natural ways of relief for low back pain. If you or someone you know is struggling with low back pain, reach out to your chiropractor. A thorough evaluation is used to determine the source of your problem, and the best unique care plan is designed specifically to help you find relief. Now, if you're watching this video, you or a loved one may have dealt with low back pain in the past. In the comments below, tell me what you did to help relieve your back pain or your loved one's back pain, and did it work? I'd love to talk to you about it. Well, that does it for another episode of Dr. C TV. I'm Dr. Jason Cardinale, and I will see you next time. Is that on? I hope it's on. What top healthcare organizations recommend. Is this even on? All right, let's try this a second time. This green background looks like I've got kryptonite back there.